Welcome to our video on principles of cancer screening and staging. Let's get started. In general, there are three primary approaches to cancer staging. There's the clinical staging, TNM staging, and pathologic staging. Now, clinical staging is based largely on physical examination and imaging findings using modalities like a CT, MRI, or PET scans. Now, here's a series of images depicting the power of a CT PET scan in identifying cancer metastases. The leftmost image is a CT scan depicting an abnormal appearance of several vertebrae, for example, here. Now, the middle and rightmost images are generated using a PET scan, and they depict areas of metastases, which you can see with those black areas in the middle of the image, for example, here, and yellowish-orange areas in the rightmost image, for example, here. In this case, there is also evidence of organ metastases, for example, here in the liver. Now, finding evidence of distant metastases usually means that the cancer is stage 4 and has a poor prognosis. Now let's move on to TNM staging. TNM staging is named after the three main components used to stage cancer following this approach. So those three components are tumor size, that's the T, and then there's extent of lymph node involvement, so N for node, and then the presence of metastases, so M. And as one may guess, large tumors with extensive lymph node involvement and evidence of metastatic disease point to a high stage cancer and a poor prognosis. In contrast, small tumors that haven't yet spread anywhere will be of a lower stage, so usually stage 1, and naturally those have a better prognosis. Now, last but not least is pathologic staging, and this relies on histopathologic analysis of surgical cancer specimens. Importantly, this is the only modality of cancer staging that simultaneously informs clinicians of the cancer grade. In other words, it informs clinician how aggressive the cancer looks under the microscope. So the idea here is that grade tells you how aggressive that type of cancer is, and then stage tells you where along the process it is, whether it's early and local or distant and there's metastases, so stage 4. Now let's examine a series of histology images to illustrate the basic difference between benign cancers and aggressive cancers. And again, this is telling us the grade. Now the image on the left depicts normal histology of the colon, and the image on the right depicts the histological appearance of an adenomatous polyp, which is a benign condition. And though these images don't look identical, they look similar in the way of cell architecture and general orientation. So the idea here is the more that a cancer resembles normal tissue, the more likely that it's going to be benign and low grade, so not that aggressive. Now compare the histologic appearance of normal colon on the left to the histological appearance of adenocarcinoma of the colon on the right. Note how there is almost no resemblance between the two images. You can even see how the cells in the image on the right are growing in a completely chaotic manner and look nothing like the cells of normal colonic tissue. And because of that strong difference, then this cancer is more likely to be aggressive and be called high grade. Let's do a quick question. What provides a more accurate prognosis, cancer stage or cancer grade? Well, the correct answer is stage. Remember that cancer stage characterizes the size of a tumor and how far it has spread. The bigger the tumor and the more widespread the cancer, then the higher its stage. And the more widespread it is, the more difficult it is to eradicate. Now, cancer grade, on the other hand, characterizes the appearance of the cells under the microscope, but it doesn't tell you how far it's gone throughout the body. And that brings us to our last point. Cancer stage informs prognosis more than grade. Now, keep in mind that a high grade can worsen the prognosis, but it's not as important. Think of it this way. The more cancer spreads throughout the body, thereby increasing the stage, then the more difficult it becomes to treat and eradicate. And that's pretty logical. If you've got metastases all over, it's in lymph nodes, and it's really hard to identify and locate, then it's really hard to just remove all that. However, a localized high-grade cancer is usually amenable to surgical excision. So if you had to choose between the two, then you would want a low-stage, high-grade cancer, as opposed to a high-stage, low-grade cancer. And that concludes this section.